inequality is driving not only the AIDS pandemic, but all pandemics. Within HIV, we've seen unequal access to medicines prolong the pandemic. And that same thing happened in COVID-19. And that same thing happened in Mpox. Things like social protection. One of the things I talked about was that during COVID-19, folks who were unable to work weren't able to socially distance, they weren't able to stay home. But countries that surged social protection, that enabled folks to be able to take their time out in the middle of a pandemic to take care of their health without worrying that they wouldn't be able to put food on the table, especially for low-income communities around the world, empirically we know that that made the difference between people being able to stay home or not. We also talked really importantly about the role of communities and the crucial importance of what we're calling community-led pandemic infrastructure. That's the nonprofit organizations, the organized community groups, the engagement of communities not only as recipients and not only folks to be consulted, but instead the deliverers of services, the deliverers of accountability, the participants in planning. When that happens, we know that that reduces the inequalities that make pandemics happen. And so we talked about all of those as ways forward. The Global Council on AIDS, Inequality, and Pandemics is doing a bunch of work in this space. And we're so happy to be here at the G20, talking to the health minister of South Africa, talking to all the delegates from all 20 of the different countries about how we can work together to address these inequalities, because it's not pie in the sky. There are some really practical, actionable steps right now that the G20 could take together to do that. One of those that we've been talking a bunch about is this question of pandemic products, the health technologies. So for example, lenacapavir, right? A one-shot, twice-a-year intervention that can stop HIV. Why isn't it being made in factories around the world right now? The G20 could shift that.